involvement of patient groups in a wide range of health policy has been increasing over the last few years. We've seen it in terms of access to new therapies, health policy, and increasingly now in health research as well. So it's vitally important that, and it's been recognised across the world by the European Union, by the United Nations, that patient involvement in health research is not an add-on, it's not a luxury, it's absolutely essential.
For me, public patient involvement means involving people with the health condition that you're researching in all aspects of the research process. I think from idea stage through to designing the research trial, analysing the results, interpreting the results, disseminating, and then feeding back to the relevant stakeholders. So involving the person with MS from idea to dissemination and everything in between.
I am from a software engineering background, and whenever we were making a new product, we always asked the customer. They always said, what do you want? And then we checked at each quality gate, we checked, is this what you want? Is this what you need? The whole way along, because it's so important to, right from the start, do what the customer wants. And I think that the patient really is the customer here in this situation. So the patient needs to be involved right from the start, and then to be asked at different points in time, is this the right thing?
I think that it's very rewarding and very good for people in particular with dementia to be involved in research, because at the end of the day, it's the voice of the person that's going to change how our world is.
A part of PPI is, of course, informing patient communities as to what your research is about and what you've done, what you've achieved. But it should be, in an ideal world, much broader than that as well. It should be involving patients from the earliest stages, so starting conversations with patients about what the reality of their lives are. And I think many people are amazed as to how much of an influence that has on the direction that research can take. So it's incredibly valuable to do that. PPI is obviously incredibly important in making sure that the patient voice is to the forefront of any decision-making processes around research. But there are more subtle benefits to it as well that we don't always think about. It really helps the researchers to focus in their planning on what the patient needs are. And it also helps the patients as well to understand the research processes and what's involved in research exactly. And if they understand that, they're just a lot more likely to become involved in research then and to participate, particularly in the case of clinical research.
Public patient involvement is important because it means that you are doing research that matters and doing research that has a greater impact on the people that are involved. I think research is very definitely made better and made easier by the input of people with MS.
You're involved in a process where you are trying to treat a condition. Unless you fully understand what that condition is, then you may not be answering the right question. So you may have a solution, but you may have a solution where there's not actually a problem. So I think it's important to know that the solution you're creating is relevant to the patients who actually have the problem in the first place.
I think patients have a responsibility to let people know what it's like to live with the condition. We shouldn't expect our clinicians and scientists to have all that knowledge and to be able to have all the answers, especially now that we're all living longer and we're having multiple conditions. So we have to step up to the plate.
I think involving patients and the public is really, really important in research, because unless the actual research is going to address their issues, the value of the research in terms of improving their quality of life is going to be undermined. I suppose in many ways I come from a clinical nursing background, so my orientation and my whole value set would be very much about making research serve the interests of the public and particularly of the patients that I would be looking after. So that would be a particular value set that I would bring with me, basically coming from my clinical background, but also I'm using it in my research and my research value set.
It's very interesting when you get involved in research and you look at the questions, and then all of a sudden you see something. There's something. Say for example, with my illness, there was something. I was involved with international research, And the first thing that stood out to me after I had read it a few times to digest it was that there was nothing about my quality of life and about how I lived. And so this research was from all around the world, where we had telephone conferences once a month, and I decided that I would approach this when we had our conference, and I said, I just don't see anything. I see everything about medical, but nothing about social, nothing about me as a person. And I was able to change that and influence that change. And for me, that was absolutely perfect. When we had completed our work, that there it was, our quality of life.
In the past, we would have been performing a lot of basic research, but we're now at the point where we're trying to bring drugs into the clinic. And then that's obviously very important, because there at that point, you are going to have a drug that's going to go into a patient. So understanding what the patient's frustrations are, what their expectations are, what they're looking for, really helps us understand what we should be doing. So we may not get a better drug, for example, but we may get a drug that only needs to be given once a year. And a patient would prefer that than getting a drug that has to be given every 4 weeks or something like that. So you can change about what you thought was the most important part of your research. So it's done that, but it's also the students and the postdocs in the lab go to these patient events as well, and you can see that now when they've met patients, it really inspires them to go, okay, now I really understand why there's an importance to what I'm doing.
Talking to people with MS about my research and about the treatments that we're designing and evaluating has really helped me understand the hidden symptoms of MS and how they impact on their day-to-day lives. For me, I can have lovely ideas about the ideal treatment, but then you sit down with somebody MS and they tell you about the realities of fatigue and how their daily schedule looks and how they are already juggling children and schools and jobs, as well as all of the symptoms and their potential mobility problems. So I think it for me it's a reality check. It's a hugely important piece of my research because it helps me understand the context of what I'm proposing.
I think it's really important that patients recognize themselves as experts, that because they are experts in living with the particular condition that they're living with. And what I would advise them is to try and bring that angle to the processes, and not to become an amateur researcher. There's lots of researchers who will be assessing the research as well, but to be that voice of the patient living with the condition in the process.
Since I got involved with MS Ireland and the Upasha course, I've been diagnosed for 6 years now, I really feel like I've had lots of opportunities to get involved with medicines research and design that I really never expected that I would. And I've found that the people that I have engaged with, for example the HPRA, have been extremely open, and the communication has been two-way. So I would encourage any patient who feels that they have something to offer, that they should just see what's out there, get involved. And for me personally, I'm very passionate about side effects, about the reporting of side effects, and I'm also quite interested in clinical trials, clinical trial retention, how they're conducted, the success of clinical trials. And obviously at the end of the day, I'm a patient and I really care about this, because when I go to bed at night I still have multiple sclerosis. I can't leave it behind. So it's something I think that we as patients can really use the energy that we have to in a positive way to work with researchers.
By being part of the steering group committee, it was a very positive experience. I felt that the clinicians really wanted to hear what the patient had to say, and as a result of all that, we seem to work more as a team now.
Remember just that absolutely almost ill feeling that how am I going to be able to participate and engage and talk about this illness, or about whatever the research was going to be about, because I knew nothing about it. And so it led me to something great, because it led by making that contact and by writing to Professor Robinson, it got me involved in cognitive rehabilitation. through that a professor that was working with him was also working with the Alzheimer's Society of Ireland, and that was the first time that light came into my life. Now, if I had not made that contact, and I really want to get this home to people that are doing research and how we feel, how the difficulties we can have, but the change that it made in my life, because all of a sudden there was a whole new life waiting for me to be an advocate for my illness that could never have happened if I didn't engage with research. But I will say it was a difficult decision for me to make.
There are plenty of misconceptions around PPI, unfortunately. I think we still have a culture change required before it becomes really mainstream. But one of the main misconceptions is that we are trying to make amateur scientists out of patients, and of course that's not what it's about, and we shouldn't do that. It's about treating patients as experts in their own right, as experts in living with a condition.
Not all researchers recognise the value. They don't. I think they sometimes think I have to have a cure before it's worthy of me talking to a patient, but they don't need to do that. They can still just understand the bigger picture and where their research is fitting in. Patients will understand I'm at an early stage of a research project, if that's what you tell me.
The biggest challenge, I think, is time. Everything does take more time. I think, especially for people with a health condition like MS, as I said, they're juggling lots of other things. We have to take into account that people have trouble with memory and thinking, so they need more time. So the time it takes in consulting with people, allowing them to look at and think about ideas, coming back to you, is definitely something you have to take into account. I think, but as I said, I think when you do that, the study will run more smoothly. So I think one of the big things we've seen is that certainly having people with MS help us design and write and give feedback on our study information leaflets. That's been incredibly positive. So it means we get less questions because the stuff that people want to know is already in there. So I think certainly time. I think for researchers, a lot of it is about losing control. You're basically letting somebody else help you do the research. And I think it's important that it's not just tokenism. We don't have people there just because we can. It's important that they have a very meaningful role in the research design and development and running. And to do that, the researchers have to devolve control to other people. And I think that's something that takes a little while to get used to. But as I said, the benefits very definitely outweigh those challenges.
When we get a call to say, would you participate in research at almost the final hour, it's tokenistic. And I have experiential knowledge, I have wisdom of what my illness is, and to be asked at the last moment what it's about and to be involved in research, it's very difficult. Also, I've been involved with research through Alzheimer's Europe, and the language that is used that researchers use is absolutely unbelievable when it comes to people with I'm not saying always, but there have been many pieces of research that I've been involved in where the language was wrong for somebody like me. I think we have to make that change. We have to engage with researchers, and that's the great thing about research for me, is that we're helping each other. I'm the researcher, I'm giving my information, but I'm also able to help the researcher to look at ways of changing the language.
In terms of the challenges of involving patients in research, I think one of the biggest challenges is getting the right patient voice on your research team. And by that I mean you really kind of need somebody who's very knowledgeable about the condition, in my situation about epilepsy, and to be able to think broader than just representing their own voice, but to actually represent the voice of more people than just their own. So to that end, one of the biggest challenges as a researcher is making sure that you actually get the right person on your team. And in many ways as a researcher, I think you do need to know what you want. Just as when you're creating a steering committee and a research team, everybody is on it because they're contributing something to progress the research. So equally in terms of having your patients, you need to know what you actually want, and you want them to actually participate, and how you want to engage them, how you want to involve them. Because this should really go beyond merely having a nominal figurehead of a patient around the table at a steering committee. If you want to involve them, you need to actually identify what exactly you need from them. Another really important thing that we as researchers can do in terms of really working towards engaging people, in my instance with epilepsy, and getting them involved in the project, is actually getting them as part of the actual, as collaborators, and getting them as named collaborators on your actual research grant application. I had 3 collaborators on my research grant, and 2 of them were people with epilepsy. One of them was a man who was slightly older, and the other was a girl, a lady who was slightly younger. So in many ways, getting them involved right at the outset and having them identified as collaborators on part of your research grant application is actually important, and to do it from the outset. And then as well as that, if you're actually a researcher, I think recognising that you value their contribution, and just as in terms of in your budget, you actually make money available for data collection and data analysis, I think it's important, if you're really going to value all of your collaborators, that you actually enable them to do the role, and to set aside some money in terms of budget for them even travelling to steering committees, you even giving them a token in terms of a gift token to actually say, thank you, we value your contribution. It has made a big difference to our research.
In many instances, patient organisations are really leading the way in PPI, which makes sense because we always have the patient voice to the forefront. We understand the research, and of course we can reach out to the communities of people that we support and involve them in a way that makes sense for them.
So one of the things that I think would help is creating forums to get people together. I think an interesting idea was MS Ireland had a researchers' lunch where we started with research around the table. I think if you build on that and have researchers and people with MS around a table sitting down and looking at potential research priorities or where things should go, I think for me, one of the biggest benefits of my partnership with MS Ireland has been access to research participants. As a researcher, it can be hard to find the right people, but when you're working and engaged with a charity and working as collaborators with a charity, they can help find the right people for the study, and I think that's one of the things that would very much help researchers.
I think PPI in health research, I don't think we should be too prescriptive about what that actually means. I think it's best viewed as a wide spectrum, and on one side it can be about patient groups being involved in kind of the dissemination of research and helping to make the research findings more accessible. But at the other end, I think it's about true partnership, and I suppose what MRCG is about moving it towards a true partnership between patient groups and research organisations and investigators.